Good morning, I'm Dr. Christopher Lawrence. I'm just going to show you a quick adjustment technique called the Activator Method. And I've got a volunteer here. We're not giving out names other than mine today to protect his innocence. Anyway, I appreciate you helping, of course. So I'm going to run through the Activator Method of Chiropractic Technique. I'm going to do a basic scan on this patient. The basic scan will take care of about 95% of all patients' complaints, and the other 5% is I use something called an advanced proficiency technique of Activator. So if we need it, we can use it, but otherwise we just go off leg length. And I'm going to steal those sandals and put on some shoes that I have for patients that wear sandals in here. The Activator boot. This should take about 3 minutes, so bear with me. This gives me an accurate reading of his leg lengths. I need both hands by your sides for me. This is a good example of an optional way patients can be adjusted instead of the manual adjusting that some people are afraid of, even though it's perfectly safe and very effective as well. Sometimes patients just don't like to hear that audible popping or cracking that you get from a manual adjustment. So using the Activator, which is a high velocity, low force adjusting instrument, and this is just a demonstration tool to show you that if there is power coming out of this, high velocity, low force adjusting, 1,000 times faster than my hands, and very comfortable and effective for the patient. He's short on the right side, just slightly, a 1/4 inch. Some of these findings you may be able to see on the video. I'm going to bend the knees a moment there, Robert. We will go by his first name at least. And that's fine. Check the knees, ankles, now the sacroiliac joints. Right sacroiliac joint, pulled the right leg a little bit short, going up, so pulling it back, increase the leg length. I need your right hand and your low back for me, Robert. Hand back to your side. We're doing the 5th lumbar. This will go through clothing. About as thick as that jacket right there is about all we want, though nothing much thicker than that. Left hand low back for me. Hand back to your side. Both hands low back, please. Both hands at your sides. Showing slight improvement already. Right hand by your head. Oh, very nice. Left hand also. There's one. Back to neutral. Hands back to your sides for me. The shoulders relaxed. There you go. Turn your face to the right, please. Okay. Couple of problems up there. Head back to center. There's 6th thoracic. Face to the right and raise the right shoulder off the table. Back down. Perfect. Face to the right again for me, Robert, and shrug both shoulders towards your ears. Back to neutral. Head to center. The first position tells me what level to adjust. In position 2, which we can see at 90 degrees, ideally, it tells me which side to adjust. So turn your face to the right again and shrug both shoulders and then roll them up, back, and downwards. Perfect. Head back to center. So what I'm showing you is just a sample treatment that takes 3 to 5 minutes tops, using the Activator Method Chiropractic Technique with the Activator instrument. Now raise your chin about 1/2 inch again, back down. Tuck your chin towards your chest and back to neutral. Okay, that shows the first cervical, the atlas, very important for headaches, neck pain, does a lot of things. Force your head into the paper for me. Occiput, this is the skull itself. We're going to put his head back on straight with this adjustment. And I want you to tuck your chin one more time. Make sure it's not axis. That's good, perfect. Rest your arms over the sides And we're going to stop filming in a moment, but keep going if you could for me, please, Janice. I'd just like to show that we do use a vibratory massager. This works very, very well with the activator technique. And with that, this patient has been treated. Thank you.